this conference is such an exciting opportunity for us as the School of Public Health to be coordinating it on behalf of Makerere University and especially jointly with the Ministry of Health, because it comes at a time when the ministry has just initiated a framework for integrated service delivery. And for the first time, we're having a joint conference of communicable and non-communicable diseases coordinated by the Ministry of Health. And so it's an opportunity for us to pull this together and integrate even further, to work together with the ministry and deliver one conference that can cover most of the pressing issues that we have in health today. We have a rapidly growing non-communicable disease burden, lifestyle driven, but we also know that non-communicable diseases are pretty complex to manage. Once they have occurred, once you have the disease, the complications are severe, and managing them is complex, it's expensive, we cannot afford that. So it comes at a time when we all feel that we should be mobilizing communities for a lifestyle change so that we can improve the messaging and interventions around promotion of health and making sure that people live healthier lives. But it also comes at a time when we realize that we have had a lot of missed opportunities in terms of addressing non-communicable diseases as separate from infectious diseases. And yet sometimes the infectious diseases actually do lead to non-communicable diseases, as we know from some of the cancers that we are managing and several other challenges that we have. And at the same time, we realize that we should be addressing diseases, rather health, not as a disease, but as a focus on individuals and people's well-being, because sometimes we even have people who have both communicable and non-communicable diseases, and working in a parallel manner has kept us from addressing all their needs in a wholesome way. So we are excited that the Ministry of Health is pulling together a conference for communicable and non-communicable diseases, and that this coincides with our 19th joint annual scientific health conference coordinated by Makerere University, and this time under the leadership of the School of Public Health. So we are excited that we have the opportunity to have this happen under our leadership, but also at the same time as the College of Health Sciences is coordinating partners to celebrate 100 years of health training within Makerere University, and our school is part and parcel of that as well. So it's 100 years, it's working together between the School of Public Health and the College of Health Sciences, but also with the Ministry of Health that has been a very, very strong partner and pillar in the health training space for many years. Working closely with Makerere University. So we are glad that we are able to pull together and engage stakeholders and speak with one voice to issues of policy, implementation, but also issues of research and how we can align our evidence to support the efforts of the Ministry of Health. So it's just a great opportunity that partners can come and hear what the ministry is thinking and driving in terms of policy, but at the same sitting, we can also hear the evidence that's emerging in the field and innovations that could help to make a difference. I think this is a good for anyone that would like to be a part of the conversation, whether it's students, whether it's policymakers and implementers out there. There will be something for everyone. But one of the other issues I would like to emphasize that's pretty obvious and in our face all the time is the changing geopolitics and how that has impacted health and the health financing terrain. This is affecting us. Many programs have been affected, either disrupted, downgraded, and so many other changes are continuing to shift. We are aware from our engagement with other partners across Africa that many governments in Africa are beginning to make changes, just like Uganda is doing right now with the integration framework. Other countries are also doing the same, and they're at different stages of making reforms to health systems so that we can better deliver health. So there will also be an opportunity to hear from our partners from the regional and global level in terms of what's happening elsewhere, at a time when all of us need to pull together and make sure that we sustain health despite some of the rapidly changing issues within the environment. And so this is a good opportunity for all the partners, and would like to encourage all our partners to be part of this conference, to support it, but also to submit their work and come and share, and also listen to what is happening from the multiple groups. I also need to emphasize that this conference is not just about Makerere University, that there are now more health training institutions within Uganda. There are more universities, in Mbarara universities participating, CITEM and others. So we are looking forward to also creating an opportunity where all these universities can come and share in the research and listen to the evidence that's happening, so that we can build the networks and continue to work together across the universities as well.